A question I'm often asked is, how exactly do I explain this to my family or the people who care about me, that I actually want to seek one of these life-threatening surgeries to get myself out from under things? When my husband or my wife says, listen, I love you exactly how you are, the answer is not necessarily that they do or that they don't love you. The answer is how you are personally feeling. Many people don't understand the private issues that you have to deal with associated with your weight. And that extends to spouses, to mothers, to fathers, to parents of all kinds. No one wants you to feel badly. No one wants you to go through your day feeling poorly. And most people at the end of the day are going to respect your well-reasoned decision that you're doing something proactively to try to make your existing life better and to make your life longer in the process. People around you want you to be happy. They want you to be successful. They want you to be able to engage in your life, not simply live your life. Bariatric surgery is a scary situation for most of those people because they are not nearly as educated as the patients who might be seeking that. Our practice, the New Jersey Bariatric Institute, has tried to provide many materials for people to be able to unburden that fear. The fear of the patients themselves is the biggest stumbling block to getting people to consider bariatric surgery in general. It's no different with family members. And in fact, our online seminar was developed so that people can watch the seminar in the privacy of their own home, that they don't have to travel from place to place, that they don't have to run from work, they don't have to arrange childcare. They can sit in the quiet and the privacy of their own home at a time when they're ready to concentrate and think about what the consequences or what the opportunities are associated with the surgery. Our entire practice is engaged in that way to try to make the process easier for the patient and the people around the patient. We use an online web program called ClarityMD. It's at www.claritymd.org. It's a very important piece of material. There's a section for gastric band, for gastric bypass, and for gastric sleeve. Each of our patients go through it before they go on to surgery. But the beauty of that program is that when our patients go through it, they determine independently whether they think it's appropriate to sit down with a family member or to send to a family member. If they have a remote family member who's in California, who's absolutely opposed to proceeding with surgery and will not even hear of any kind of discussion of it, if they send them the links and they allow them to go through the program, it takes much of the histrionics out of the conversation and allows people to have a conversation on a human level, on a reasoned understanding level, where you can talk about the facts and the issues that you're dealing with, rather than the anxieties associated with these procedures. No one wants you to have problems. Everyone is worried about your safety and your overall health and happiness. If you look at the safety related to these procedures, it's actually safer, statistically right now, to have any one of the bariatric surgical procedures, which are commonly covered by insurance, than it is to have your gallbladder taken out. No one would argue that it would be the right thing to take your gallbladder out if you had pain related to your gallbladder, or your colon out if you had colon cancer, yet they'll argue about the idea of having bariatric surgery. They don't understand the consequences to your life on a day-to-day basis. You do. And it becomes an issue where if you can find the right tools, you can explain that and you can both be more comfortable with the process.